in the days to come. It's been less than 24 hours, so we're actively reviewing what the governor announced yesterday with our team.
Are your numbers going up or down right now? What's the problem?
So I can tell you that we had seen very encouraging signs as people were doing the right things, wearing their masks, honoring the restrictions, getting their vaccinations. In recent days, however, our numbers started to level off. And so, we are obviously taking a look at what those numbers are as we sort of consider our next steps in response to the governor's announcement. She said, so before the announcement, local governments could only be more restrictive, not more permissive. So it really wasn't an option under the prior orders. Look, we want to open, just like with our schools, as quickly and safely as possible. But the key is to do both, to do it as quickly, but also to do it safely. And with the variants, with only 15% or so of the state being currently vaccinated, these are all factors we have to weigh in reviewing what the governor announced just yesterday, less than 24 hours ago. Yep.
Montgomery County said they're one of them. What about you?
Well, thanks, Kate. As we toured this site, the governor again said this is the best site he has seen in the state of Maryland. He called this a Ferrari without enough gas. Dr. Branch will tell you that this could be a 24-hour clinic where we can do upwards of 1,000 doses per hour at this site. So you think about the fact that we're only getting 5,000 doses a week. The capacity just here is limitless. We're welcoming the opportunity to serve not just Baltimore County residents, but the region and the state, because candidly, the only way we get through this is to have all of our residents vaccinated. The virus doesn't know borders, doesn't know boundaries. It's why we're reaching out to our residents through this campaign. And candidly, to the earlier question, it's why this campaign is so important. As the governor is opening up and trying to push for that effort, getting people vaccinated becomes all the more important, and this campaign is all the more important.
If I may, are you reluctant to say that you are in this? I understand you're making a pitch here, but are you in discussions, for example, in Germantown, FDA just set up a site tour
Yeah.
with the health department and the National Guard. Has it gotten to that level here, or are you still just like advocating?
I'll let Dr. Branch add, but we're already ready to go. I mean, we're doing the work. The issue is, it's just we're running on fumes in terms of the gas, which is the vaccines. And so I made a direct plea to the governor when he was here. I said, give us the doses and we'll get it done. So we're ready. We don't need to be stood up as a mass vax site. We're already one. We just need the doses. So I don't know if you wanted to add to that, Doc.
And I can just add to that and just say to you, the National Guard has been here. We've had multiple jurisdictions come out, and everyone looks at Baltimore County as the gold standard. And people are really trying to use what we have here in other locations. Even though we are ready and set, we're not a state mass vaccination. We are mass vaccination, and we're open to the state.
County Executive, the State Department of Education said yesterday that the percentage of teachers and staff who requested to receive the vaccine in Baltimore County is at 27%. A lot of other jurisdictions are higher, some are at 100%. In getting teachers vaccinated, what's your response to that and your efforts, if you can explain?
Well, first of all, I'll say I have no idea where they got those numbers from, because we certainly have not had that data shared with us. And I can tell you that thousands of educators have been surveyed by TABCO and ESPBC, so the organizations that represent teachers. And of those thousands who actually have been surveyed, and we know where the data came from, 62% have already been vaccinated. Many more have a current appointment. So, and almost 60% of those vaccinations were from us. So we know that based on the number of teachers we've vaccinated already through our system, based on the survey from TABCO and the educational support professionals, those two labor organizations, we know those numbers do not jive with what we have as our own data set. So you'd have to ask them where they got that data from. It certainly does not seem accurate at all to us.
So it's a survey and not a hard number as far as you're concerned? You know who got vaccinated, it's just a survey?
We know how many educators we've vaccinated for sure, And we know that that number far exceeds whatever number they're using. And then sort of the survey of educators from these partner organizations sort of validate the fact that we know that those numbers don't seem right at all, that they're sharing it from the state.
As far as the equity issue is concerned, the big criticism from the city is that a lot of folks can't get to a mass vaccination site. You have 3 of them here in the county.
Yep.
What's been the effort to get to the pockets of places that are underserved?
Yeah. So part of it is making sure people know that the registry is available and getting them on the registry. We're also making broadband more available. We've expanded Comcast Internet Essentials to tens of thousands of houses. We are using our 311 system for people who don't have technology, so they can both register and coordinate transportation. So we're providing Uber for anyone who does not have transportation to a site. Phil, you mentioned both this site, the site in Randallstown, and in Essex. We're going to be expanding further in community clinics, but part of the challenge is we just don't have the doses. We don't have enough for just this one site to be fully operational, so it's really hard to expand further. But we are going into places that are homebound. It goes back to this campaign, meeting people where they are, and give us the doses, we'll get it done. We, again, have been heralded not just as a statewide leader, but frankly a national leader in terms of how to distribute doses. So get us more doses, let us be the leaders that we are in this space, and we will make this region and this state shine if we have the doses.
Last question. Actually, it's a two-part question, but it might be
1.5 left.
okay, the thing people are emailing and texting me about that they're most confused about are the CDC, new CDC guidance for newly vaccinated. Is there any way you can kind of explain what that actually means? And if someone's on your registry, but they're waiting, and they're eligible for it, can you explain that they're eligible to get the shot elsewhere in the state, not just doing health work? There's a lot of confusion about that.
Okay.
Even though you're restricting that they apply, doesn't mean they're not eligible.
Okay, so I'll start with number 2, and then I'll go back to 1. So if a person anyone who lives and works in Baltimore County can apply to our registry. That is okay. It doesn't make a difference which tier you're on. Once you apply to our registry, we will then invite you for an appointment when we have enough vaccine based on which tier is identified as to how you register. If a person wants to, they can register at multiple locations. They don't have to only register in Baltimore County. And then depending on whoever calls them first, that is who they should go with, and that's the vaccine that they should take. As it relates to the CDC guidelines, it is wonderful that we're vaccinating more people. And what we're trying to get to a point now is to get people to want the vaccine. And the key at this point now is if you have a vaccine, and if someone else has the vaccine, and the point is that you guys can get together, and then you guys do not have to wear your mask in your own small party, not in the public. In the public, everyone should continue to remain wearing their masks.
Dr.
Okay.
Brad, just one follow-up on the equity issue. You said that the county has 30% black community, but 13% are only registered. Explain that, and why do you think that number is the way it is? What do you attribute that to?
Okay. So
Is it hesitancy? Is it access? Is it another reason?
I think it's all of those reasons combined. So I think that some people are hesitant, and we know historically the black and brown communities have been hesitant for different reasons, but they have been hesitant. And then also I think it's because of access and being able to utilize the computer systems. And that's why we're going to go to the people in the community so that we can actually vaccinate them that way, so that we can just take away all of those barriers. If transportation is an issue, we're going to take that barrier away. If not wanting to leave your neighborhood is an issue, we're going to take that barrier away. If you wanting to go someplace where you feel comfortable, like your church, a faith-based institution, we're going to take that barrier away and bring the vaccines to those locations. So we're trying to do it all as time goes on. And at this particular time, unfortunately, we do not have enough vaccine to do it all. But we can do it all. We will do it all. And we will vaccinate everyone.
Let's
All right,
give us
no, thank you,
that-
Bill.
Okay.
Thank you. We're done.
Good job, Doc. Thank you again.
Sure, my pleasure. You need more, we can pull you down. You need to follow up with Brand?
No, I'm good.
Okay.
Hey, how are you?